Welcome back to the programme. Good to have you with us. The growing number of new monkeypox cases across Europe is sparking concern, with the World Health Organization warning that the risk of infection on the continent is high. Now, the European Union has approved a smallpox vaccine for use against the disease. In France, where about 1,700 people have been infected with the virus, authorities have opened more than 100 vaccination centres. France is just one of nearly 70 countries with confirmed monkeypox outbreaks where the disease was not originally endemic, a global spread that the World Health Organization says represents a global health emergency. Just under 10,000 cases have been reported in the European Union as a whole. Well, joining me now is Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter Medical School. Great to have you with us, Doctor. Now, we saw at the weekend that WHO went ahead. They declared monkeypox a public health emergency of international concern. How worried should we be?
I think with monkeypox, we can control it, maintain it, and eliminate it. So whilst the WHO has declared it as a public health emergency of international concern, my view is, yes, okay, that is a call to action. But the actions that we can take, provided we take these actions fast, early, and extensively, we can control it, manage it, and remove it from human circulation. If we don't remove it from human circulation, my concerns are if it becomes present in the animal population, then we've got a problem.
So we've got the actions which no doubt public health authorities will be taking in terms of contact tracing and so on. But what about protecting ourselves? What can we do? Because right now we're seeing vaccines being approved for use in Europe. Should we ourselves be seeking to get vaccinated?
No, not at all. So people in the at-risk groups will be offered the vaccines, and that is correct. So it's at risk, I mean, people, men who have sex with men, men who are bisexual, as well as healthcare workers, and also contacts of those cases. So at the moment, we need to do targeted vaccines rather than vaccinate everyone. And by the way, people who are aged over 50 will have some immunity from the days when they were immunized against smallpox all those years ago.
And if someone thinks that they may have been in contact with someone who potentially has monkeypox, they think that they might be infected, what should they do?
Well, the first thing is don't go and make a few more cases of your own. So you will isolate yourself, pick up the phone and call your doctor and discuss this with your doctor. Do not turn up at the local A&E or your doctor's surgery. Best to go home and then call your doctor from your home.
All right, crystal clear advice there from Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter Medical School in the UK. As ever, thanks for sharing your knowledge with us.